Hi students, it's Dr. Marks and we're going to talk about the Affordable Care Act, just the basics. And this is one of the most comprehensive changes we have seen in healthcare. I think you're going to find it interesting, but it will also tie into some of the things we've talked about in class. First of all, what is it? What is the Affordable Care Act? Well, it's a newer federal mandate for healthcare. And when I say newer, we're talking about something that started in 2014. So when I say a federal healthcare mandate, this came from our federal government, passed by Congress. So started in 2014. What was the goal? Well, as you can imagine, the goal is to expand coverage to 32 million Americans, and these are people who were uninsured. Now, in class, we've been talking about the problem that not everyone has access to health care in our country. So the Affordable Care Act is trying to close that gap, expand coverage to those people who don't have health care, who were underinsured or uninsured prior to that point. You may have heard the Affordable Care Act nicknamed Obamacare. Well, why Obamacare? Because this was passed during the Obama administration. So, a newer federal health care mandate that started in 2014 to try to close the gap and cover those people who didn't receive health care, who were uninsured. And again, this happened during the Obama administration. Now, what is required of the Affordable Care Act, or again, Obamacare? A core element of the program when it passed, and this is really important to understand, this core element, this is a big change, is that everyone in the United States was required to have a minimum health insurance policy. So in other words, you couldn't just go uninsured. You were required by law to have a minimum health care insurance policy. Now, you might be thinking, by minimum, does that mean I can buy something that barely gives me much coverage, maybe only catastrophic insurance? Well, the answer is no, because it had to be a minimum. It had to meet the minimum as defined by this legislation. The problem is, if you didn't do this, you would face an annual fine. So, the law basically said it's illegal to not have a health care policy, and everyone's going to have one, and it has to meet these minimum requirements. Basically, it has to be comprehensive enough to give you some protection, but if you don't do it, then we are going to fine you. And this became the law. So that's at the core of the Affordable Care Act. You can imagine that after this passed, the immediate question is this legal? Can you require people to buy health care and fine them otherwise? So this became a huge debate. As you can guess, this was challenged in the courts, right? And so there are a lot of people saying, legal scholars saying, this is unconstitutional. Our Constitution does not give the federal government authority to mandate that people have health insurance. So they fought this out in the courts, but ultimately, at the end of the day, when it went all the way up the food chain, it was deemed constitutional. So that door shut. Is it legal? Well, the courts deemed that it was legal, that the federal government does indeed have the power to make people buy health care. And I don't know much about this case, but remember, the federal government has the power to tax you, and people were saying, look, this is just like a tax. It doesn't really work any differently. We're forcing you to buy something, just like we're forcing you to pay taxes. And I'm oversimplifying, but we don't want to get into the legal issue, but it was a really interesting thing to pay attention to. Now, one important element of the Affordable Care Act is the role of employers. So part of this burden falls on the employers. So if you're an employer, you might have had to start providing health care. Specifically, if you're an employer and you have more than 50 full full-time equivalent employees, and I'm going to explain full-time equivalent employees, but if you're an employer and you have more than 50 people, by the time we look at full-time equivalents, it's just basically a mathematical formula, well, then you had to provide them health insurance. And again, it had to be a health insurance policy that met these minimums that were part of the law. Now, if you're an employer and you have more than 50 full-time equivalent employees and the law says you have to provide them health insurance and you choose not to do that, well, you're violating the law and you would have to pay a fine per worker. Now, I think you might have gotten a choice so that you could just choose to pay a fine, but those were your options. Give people health care, pay the fine. So this is pretty interesting. Now, you might be thinking, okay, well, what if I want to hire my 50th person? Maybe I have 49. Are you hiring that 50th person? Because all of a sudden you're now big enough where you have to start providing everyone health care. So this is a little problematic, and it's going to create incentives, right, that are a bit perverse. So remember, back in our guiding principles, we talked about that people respond to incentives in predictable ways. Well, if starting at 50 full-time equivalent employees, you have to pay for health care, you're not hiring that 50th guy, right? Am I right? Now, you may be thinking, I'm just going to hire a lot of part-time workers. So let's ask that question. Can firms avoid this whole healthcare expense by using more part-time workers? If you use part-time workers, maybe then you don't have to give them health care. Well, the answer is no. Because look, Congress was smart enough to know that firms would start doing that. And that's not in anyone's benefit, right? Part-time workers generally don't get benefits, they don't get retirement. So we don't want to create that incentive. So here's the deal. If you have two people working 15 hours each, that adds to 30 hours, but that is considered one full-time equivalent. So see what I mean? You could have a bunch of part-time workers, but they're still going to add up to a full-time person in the eyes of this law. So you can't just strategize and hire a whole bunch more part-time workers. That is not going to get you around this legislation. So you get the idea that all of a sudden now there's a burden on these mid-sized firms. Now, my husband's firm wasn't affected. Now, he already gives his workers health care, but it's just himself and one other person. And so he wouldn't be big enough to have to deal with this. But if you're a mid-sized firm, you might be. What is the overall goal of this legislation? Well, a key goal is to lower costs. And we've already talked about the fact that healthcare is really expensive. But here's part of the issue. If you're a large company and you've got a ton of employees, you can negotiate better prices. So you're shopping around for health insurance for your workers. But let's say you've got, 500, 1,000 workers. You're a big firm, or gosh, think about, Apple and IBM and Microsoft. They can negotiate good prices because they're buying in bulk. So a large company can negotiate better prices for healthcare because they're purchasing in bulk. And let's think about the Commonwealth of Virginia, right? In this state. Well, I'm a state employee. All people at public universities are state employees. All public school teachers are state employees. Everyone in all the state agencies are state employers. There are so many people working for the Commonwealth of Virginia. So the Commonwealth of Virginia gives us health care, and they did before this law, of course. I've had health care always here at Longwood University, but my point is that the Commonwealth of Virginia is a really large negotiator. And so they're going to be able to get a better price because all state employees are part of this health care plan. So my point, they can get lower prices than an individual can. If you yourself wanted to try to go buy the policy that I have through the Commonwealth of Virginia, it's going to cost you probably a lot more. So we want to focus on this large-scale purchasing power. Now, I'm going to come back to this in just a second because this is what the Affordable Care Act is trying to do. It's trying to create this same benefit for individuals because big companies already have it. Governments already have it. But the little firm with 1 or 2 employees or the individual who needs to go buy healthcare in the marketplace, they don't have this kind of purchasing power. But before we do that, I pulled my healthcare plan from 2014 so you could see what it looked like. Now remember, the Affordable Care Act started in 2014, so I'm comparing it to my healthcare plan in 2014. Of course, as I record it, it's many years later, and so the prices are not going to be current. But this is my healthcare plan through the Commonwealth of Virginia. Now, let's not worry about the split. Let's focus on that part that I have in blue. The cost of my policy in 2014, the year that the Affordable Care Act started, just an employee only. So if I'm a single person, I'm not married, I don't have any kids to support, my policy would be $501 a month back in 2014. The next column says employee plus 1. That's me picking up my husband. Let's say I'm married, but I have no kids. Look at now, I've got to pay, the total cost of the policy, I'm not paying at all, is $927. And if I need to pick up my children, now I'm at $1,355 a month. That's the cost of my policy. So in yellow, I've just multiplied that $1,355 by 12 months, and the cost of my policy is $16,260 a year. That's to insure my family. So husband, 2 kids, and of course myself. Now, I'm not literally paying that because you see here, there's an employee portion. I pay $165 and the employer, that's Longwood University or the Commonwealth, pays $1,126. And then there's a little bit of a subsidy. But the bottom line is I don't pay this, but somebody does, right? The Commonwealth of Virginia does. Now, let's bring it back to the point I just made that the Commonwealth is going to get a better price than you're going to get if you're a little bitty business or you're going to get if you're just an individual needing to pick up health care. And this is expensive. And remember, this is 2014. There's been a lot of inflation in health costs since then, and health insurance has gotten more and more expensive. So here's the deal. The Affordable Care Act is trying to mimic this large negotiating power. It's creating exchanges. I'm going to use that term exchange. So the AFA creates exchanges. And what an exchange is a way to pool people together. And by pooling people together, and these are kind of random people, they don't have to know each other, but if a bunch of people want to sign up for this policy, then the state can pool them together, and when they pool them together, there's negotiating power. So you could go to the exchange and buy health care, but be grouped with a whole bunch of other people wanting that same policy, and now there's a bunch of people that can negotiate together on your behalf. Now, from your perspective, if you are getting health care through the Affordable Care Act, you don't really know what's going on behind the scenes. So from your perspective, this is just a website. You're going to a website, you're seeing your different options, so you're going to choose a policy. And so this exchange for you doesn't look anything different than kind of a state-run website where you're going to choose a policy. It's what's going on behind the scenes that's working to your benefit. So behind the scenes, what this website is doing is it's pooling people together because the state is negotiating on your behalf to get the price down so that you get a better price, just like when the Commonwealth of Virginia negotiates for their thousands and thousands of employees, or a company like Apple or Microsoft with so many employees, they have that same kind of bargaining power. So that's what's going on with this idea of these exchanges created by the Affordable Care Act. So that's a great idea, right? That makes sense. However, even with these exchanges in place, it is still expensive to purchase healthcare. So I showed you the price for my healthcare policy back in 2014. And again, that's the year this program started. And I'm under the Commonwealth policy that is being bought at a discount because of this large negotiating power. So it's still expensive. We've not made healthcare drastically cheaper, right? It's not drastically more accessible. However, there is some financial assistance built into the Affordable Care Act, and that is what makes it more helpful. So the exchanges does have some benefits, but it's also the financial assistance that has to be put in place, or else this just really isn't going to work, right? So basically, there are subsidies. Subsidies exist. In other words, there are people who are going to be able to get money to help defray the cost. So that's what we mean by a subsidy. A subsidy is just money that's offered to help defray costs. And so the idea here is that there's going to be money built into the Affordable Care Act, and that's going to be used to help lower income families. So obviously we're targeting the subsidies to lower income families. Obviously we don't want to give subsidies to high income families because they probably already get their health care through their job. Like I get mine through my job, and mine isn't in any way related to the Affordable Care Act, but lower income families, they're going to be the ones that need the help. But here's the deal. If you are below the poverty line, and I'm sure you've heard that term poverty line, but it's basically a federal line for income. It's indexed by family size. So there's going to be a line for one person, a line for a married couple, a line for 3 people in a family, a different poverty line for 4 people. Anyway, family size changes the poverty line. But if your income falls below the poverty line, you are considered to be in poverty. Now, being above the poverty line does not make you rich by any means, right? The poverty line is pretty low. But here's the deal. If you are below this federal poverty line, you are not eligible for these Affordable Care Act subsidies. And you might be thinking, why in the world will we take the poorest people in our country and say you can't have any of these subsidies? Well, here's the reason. Because they can get Medicaid. So basically, the Affordable Care Act is trying to help people who are not eligible for Medicaid. We're going to let Medicaid still handle the poorest people in the country, but then we've got people who are low income and aren't eligible for Medicaid, and they're the ones that need help. The problem, though, is that we still have a gap. I would love to tell you that the Affordable Care Act has solved the problem, but it has not. We know that there is a population of people in our country that are unfortunately too poor to receive the subsidies. So the rules of the subsidies say who they go to. So we have a gap. We have a population of people that are too poor to be eligible for these Affordable Care Act subsidies, but they make too much money to be eligible for Medicaid. So we've got this population of people that can't get the funding from Affordable Care Act to help them, but they also can't get Medicaid. And that's why I'm calling it a gap. There's this gap of low-income people that just fall through the cracks. And we know this. We know this. So here's a graphic to kind of help you understand that. On the left are those people who are covered under the Medicaid umbrella. So you see them in those red. Then you see on the other side blue, and those are the people that got the subsidies. Now it's in the form of tax credits, which I think we've talked about before with education, but that's basically the form of the financial assistance. Here's the problem. Let's look at the people in gray who are not covered. Now, the people in gray, first of all the way to the left, we have somebody who's really, really, really poor, but they have no children. That guy standing way to the left, poor, but he has no children. So he's not going to get Medicaid originally. Then you have those people in the gray area in the middle, right? You've got all adults. So the kids get Medicaid. The adults don't. But they're making too much money for Medicaid, and they're too poor to get the tax credits. That's the gap I'm talking about. All those people in gray are the gap, and we haven't solved that problem with the Affordable Care Act. So again, I said I'd love to tell you that Affordable Care Act has closed the gap, and we know it has not. So we're worried about these people right here in the gap. All right. So this isn't going to be enough. We're going to have to make some additional changes, and we do. First, we see changes in Medicaid. Now, remember, not Medicare, but instead Medicaid. Medicaid, remember, is health care to people with low income, and Medicare is for health care for retirees. So how do we shrink the gap by using Medicaid? Well, what we have to do is expand Medicaid. And states have actually done this. So we have shrunk part of the gap, but not all of the gap, by our expanding of Medicaid. And that's something that states have had to do, guys, and it's expensive, and it's paid for with taxpayer dollars. So this is just one more thing that eats at government budgets. Before, Medicaid focused on families with kids. So remember that guy in the picture just a second ago I showed you, that guy who was gray all the way to the left? He was really, really poor and otherwise would have been eligible for Medicaid, but he didn't have any kids. So that made him ineligible for Medicaid because Medicaid focused on families with kids. So originally, before changes to Medicaid, it was very difficult to get Medicaid if you had no kids. You had to basically be destitute and have zero income. Otherwise, you did not get Medicaid. So what did we do? We expanded Medicaid to these low-income adults. And these low-income adults, I'm talking about those who are without children, that guy in the gray to the very left of the graphic I just showed you. So now he gets to pick up Medicaid. And I told you about my kind of unofficial child, foster child that I took in who was homeless. Well, one day she gets a letter in the mail saying she is now eligible for Medicaid. Well, she wasn't before because she was without children and just a working adult, but a working adult not making very much money. So that is something that has changed. Again, that's a good thing. But remember, who pays for this? The state has to pay for it, which means Virginia taxpayers have to pay for it. And we already have a lot of other things to pay for. So I'm not arguing that this was a bad idea. I'm just wanting to remind you that there's no such thing as a free lunch, right? Everything is going to involve a trade-off. We didn't close the entire gap with this Medicaid. There's still a gap, unfortunately. Now, we've made some good reforms in the health insurance markets, and I think I've mentioned a little bit about this in class, but if not, you'll understand this very easily. First, it is now illegal to deny coverage to somebody with a pre-existing condition. Remember, that pre-existing condition makes that person more expensive. So if I have had a history of cancer and I'm trying to pick up insurance with a new company, they may not want me because I have a pre-existing condition. But now it's illegal to deny coverage. They can charge me a lot, but they can't deny the coverage. So that's a good thing. Second, children are allowed to stay on their parents' healthcare plan until they are 26. And guys, that is a really important reform because it didn't used to work that way. So children can stay on the parents' plan. They have to be allowed to stay on the parents' plan until they are 26, unless they don't want to. Before that, guys, the insurance companies dropped children at college graduation. So imagine that, guys. You are on your parents' policy, then you walk across the stage at Longwood University, you get your diploma, and boom, you've just lost your health care. But you might not have a new job yet. And if you don't have a new job, then you have no health care coverage, and that is a problem. To pay for Obamacare, we need to appreciate that there are some significant expenses, right? No such thing as a free lunch. This is not a cheap thing to pull off. First, we've talked about that states are running these exchanges, right? Those aren't free. So they've got offices negotiating policies and prices. There are big websites that have to be built and maintained, right? You can't just have like two people running an exchange for a state. We've had to build an entire network to handle these exchanges. So that's a cost in and of itself. But then we have to add those subsidies, right? The money that we're giving to lower income households, that's not free. So we're spending a lot of money on that. And then we have to add to the states running the exchanges and the subsidies for the low income households, the expansion of Medicaid, right? And that was done by the states. If states are expanding Medicaid and having more people be eligible, this is going to cost money as well. And there's other expenses, but this is really kind of the nuts and the bolts of it. Do we agree there are some significant expenses in the Affordable Care Act, which means we need revenue to pay for this? We can't just take more and more from taxpayers, and we don't want to cut other things that are important, like, environmental quality and maintaining our roads, and we have schools and those kinds of things. We need to find a way to pay for it. So we've created some revenue streams. For example, and I'm not going to give you all the details because we don't care about all the details, but you need to understand these things, that we put a new tax on investment income. Like if I play the stock market and I make money, if you're high income. So not so much me, but my husband, this would have affected him. We'll talk about some changes in the law, but the first idea was, okay, let's stick a bigger tax on investment income if you're high income. So if you make money when you invest, you're going to pay an extra tax, and we're going to put that money towards this Obamacare Affordable Act program. Second, there was a really big special tax on health insurance plans that were considered to be Cadillac models. Now, what am I talking about there? I'm talking about for those people who could buy a health insurance plan with all the bells and whistles that had a really high dollar value to it, they had to pay a special tax. Now, my plan that I showed you a second ago is not a Cadillac model, and I have good health insurance, but it's not a Cadillac model. So for those rich people who are buying the best top of the line healthcare that covers absolutely everything and has a really high market price, that's a Cadillac plan, and they paid a special tax. Then there was a special tax on tanning services. All right, that seemed a little random to me, and maybe it's because it's an unhealthy activity, and we already tax other unhealthy activities like drinking. You pay taxes on alcohol, and smoking. You pay big taxes on cigarettes. So why not tanning, I guess? But it seems random, right? Then number 4, there was a special tax on brand name prescriptions. So if you got a brand name prescription, you paid a special tax. And maybe the logic was to encourage use of generic drugs. Right now, there's a lot of generics where if you get the generic, it's very inexpensive. And so maybe the tax on the brand name prescriptions was to generate money, or also encourage people to consume generic brand drugs, which lowers the price tremendously. And then there was a tax on medical devices, which is kind of weird, right? A hospital needs to buy a medical device. They pay a tax. Seems like we don't want that. We don't want to discourage medical device investment, but it's not a huge tax, 2.3%. But anyway, those are some of the funding mechanisms for paying for this Affordable Care Act, because as we talked about it, it's going to cost a pretty good sum of money, and it's going to be important that we have revenue. Now, on top of that, there was also a focus on reduction of fraud. And I don't have all the details about how they were going to reduce fraud, but we've probably talked about this in our class that we have medical fraud. We have people lying when they apply to get insurance and hiding pre-existing conditions to save themselves. Now, of course, they can't be ruled out, but they're going to get a lower price if they don't have pre-existing conditions. And doctors have to spend a lot of money to try to document things to fight fraud. Insurance companies have to deal with fraud. So the idea is if we reduce fraud, we can save money. The doctors save money, the insurance companies save money, government saves money. Great. Well, this all seems like a pretty good idea, but it was very politically divisive. The Affordable Care Act has truly been one of those highly divisive issues. So red versus blue, Republicans versus Democrats, they just did not see eye to eye on this. And there have been people that wanted the Affordable Care Act to be repealed. Now, again, keep in mind that a lot of people didn't like this idea that you were mandated to buy a health insurance policy or pay a fine, and that it was illegal to not have health insurance, right? That was fought at the very beginning in the courts, but the court said it is indeed constitutional. So there have been people that wanted the Affordable Care Act repealed. There's been more of this type of sentiment focused in the Republican Party more so than the Democrats, which, makes sense. This is a more invasive policy. But here's the thing. If we just completely killed the Affordable Care Act, this is going to drastically change healthcare in the United States, right? We no longer have those exchange programs that help people to get lower prices by pooling people together so that they mimic a big firm who's got negotiating power. And it would eliminate those subsidies. And I don't know if it would result in Medicaid being shrunk, right? We expanded Medicaid. So the ship maybe has sailed, and it would probably be the case that a lot of people would lose access to healthcare if we literally said, okay, the ACA, the Affordable Care Act is being repealed. It will no longer exist. But that's what people were pushing for, and again, mainly the Republicans. But then, as the headline suggested, Republicans started to abandon the idea of the Obamacare or the Affordable Care Act being repealed. So they were really trying to actively kill this, but instead they decided to settle for some revisions. So the Republicans did change their view, and this happened post-2022 elections. As I said, the Republicans abandoned the goal of trying to repeal the ACA, but they literally were trying to kill it initially. But instead, we've seen some changes. So it doesn't seem like it's going to be going away, but it has evolved. Let's talk about some of the changes that we've seen, because some of them have been pretty dramatic. So, changes in the Affordable Care Act. Well, what are they? And I'm not going to go through every single thing. It would not be that interesting, but let's talk about just the major changes in the Affordable Care Act. Well, probably the biggest one is that individual mandate that you had to have health care, and if not, you had to pay a fee. That's repealed in 2019. So we're going to keep the exchanges and the good things about the Affordable Care Act, but you no longer violate the law if you don't have health care. So the federal mandate that everyone has a health care policy that meets a minimum, that was repealed. That was taken away. But here's the interesting thing. When that federal mandate was taken away, some states added in their own mandate. Some states added in their own mandate. So in some of the states, the federal government took it away, but then you had it added back by your state. Also, that Cadillac tax on the health insurance, that was repealed. That was taken away. So that's kind of interesting. They no longer tax those Cadillac top-of-the-line healthcare plans. And then the tax on medical devices was repealed. And I'm sure some other things have changed too. But what I'm trying to point out is that the Affordable Care Act has changed in some major ways, specifically that individual mandate where it was illegal to not have health care, and then taxes changing. So there's been a loss of revenue. And with a loss of revenue, we have to ask ourselves, because this is not a cheap policy, right? How do we pay for this? And I think that question is still out there. We know it's expensive, but it's not clear if we can sustain this. And so that leads us to a great political cartoon that I want us to take a look at, which says on the left, defend it. So again, who are those? Represented by the donkeys, right? We have the Democrats. And then in the middle, we've got the elephant, right? Those represent the Republicans, and they're saying defund it. So then Democrats are saying, yay, Affordable Care Act, we want it. The Republicans are saying this is not a good idea. It's expensive. Let's not have it. Let's get rid of it. And then on the very right, somebody's saying, hey, let's let it collapse under its own weight. What do they mean? Well, they're saying, look, it's expensive. We are losing some of our funding sources. States have had to expand Medicaid. Basically, this person in the right is simply saying it's not sustainable. It's going to die. It might die a slow death, but it's going to eventually implode because it's so invasive and so expensive. But who knows? We'll see. Now, finally, guys, I want to leave you with this idea that it is going to be challenging to reform healthcare, but reforming healthcare doesn't have to be simply keep it as it is or have national healthcare. There are other ideas. I don't see our country ever moving towards literally national healthcare Canadian style. I don't think that's going to happen. So what we have to do is get creative and think about ways to expand coverage, make it more affordable, still allow healthcare to be good, high quality, accessible to these people who do have money to pay, because I don't want my healthcare to change drastically. And that's just going to take some creativity. There's no easy answer, but we just need to keep pressing on and trying to solve this problem. So I'm going to leave you with that. Thank you so much for listening. And this has been just a very basic overview, but do let me know if you have any questions. Have a fantastic day.